good morning, good evening, whatever it is time for you that you are watching this podcast. Today, we are the Mental Health Podcast. My name is Louis, your host with the most. And today, guys, we're going to be talking about PTSD. Today, I am joined by my lovely classmates as well. I'll let them go ahead and introduce themselves before we go ahead and jump into it.
I'm Bailey Ramirez, physical therapy concentration.
I'm Michael Durand, also PT concentration.
I'm Austin Blake, also PT concentration.
And I'm James Paul Duran, also PT concentration.
And I'm the outlier with OT, occupational therapy, in it. But today, guys, we're going to be talking to you guys not about OT, PT, but about PTSD, which is post-traumatic stress disorder. First, what we're going to go ahead and do is we're going to go ahead and define it. So PTSD is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. A lot of people who go through traumatic events may have difficulties adjusting and coping, but with some good self-care, they tend to get better. Typically, if symptoms last a few months or more than a month, you may end up being diagnosed with post-traumatic stress disorder. Getting effective treatment for PTSD is absolutely critical to reduce its symptoms and improve overall function in the person. But kind of getting towards the causes, getting towards the root of the problem, Mike actually knows quite a bit. So Mike, what can you tell us about the common causes of PTSD?
Yeah, absolutely. PTSD is usually associated with military or police careers due to the violent situations that these careers face. And it is true that these fields of work have higher rates of PTSD, but it's not the only situations that cause PTSD. Some additional causes can include car accidents, sexual assault, serious health issues, losing children, domestic abuse, and a bunch more. Causation is not fully understood, but is usually related to a sudden exposure to severe emotional or physical stress. And I think it's important to note that PTSD and trauma are not the same thing, despite having a correlation and similarity. Those with depression, anxiety, or a lack of support are generally at a higher risk than those that don't, and are more likely to suffer from PTSD. Hormonal imbalances are also seen in people with PTSD, as well as increased adrenal levels, all of which can atrophy the hippocampus.
Yeah, so going kind of based off what Mike said, the amygdala is actually the part of the brain that is responsible for those emotional memories. And such things, anything that triggers you, it does trigger the fight or flight response in your body. So Mike did mention some of the severe causes of PTSD, but I think it's important to understand that PTSD is different for everyone, and it can come in like more simpler forms, such as like when you listen to a certain song and it triggers you, or you like smell something and it triggers you, or even like hearing like a certain sound. I think a way to like overcome some of these things is just exposure therapy, especially with like music. You can like override that trauma and just turn them into like positive memories or associate it with something else. With that exposure therapy, it is like a resilience enhancing intervention. So it is like post-traumatic growth overall. Kind of just giving like a little story, something as simple as like a sound. Everyone has, for the most part, like an iPhone, and I know like the iPhone ringtone is common for everyone. I know a person who is an emergency responder for the El Paso shooting, and at the end, in the night, when like Walmart was empty, all you could hear is like the ringing of the phones. So she'll be out in public and she's just triggered by that because like people were trying to reach their family, and it's just like triggering for her. So overall, yes, there is like severe causes of PTSD, but it's important that these forms can also come in like simpler forms as well.
And I'm so glad that you mentioned that too, because a lot of the times when we associate PTSD, we tend to go towards our veterans or people who've experienced severe violence, but post-traumatic stress disorder isn't always in that case. Sometimes it's emotional as well, you know. And I'm so glad you defined it that way, because I'll be very open and honest with them. For a little while, I started thinking I was going a little bit crazy. Being open and honest, past 2 Decembers have not been the smoothest for me. So there has definitely been like a heightened sense of anxiety throughout this month of November. Today is November 20th for context. So I'm very glad that you defined it that way, and like that we're able to talk about it, that it's not just sometimes through extreme violence, it's through other life circumstances as well. It's like, okay, hold on. It's your body naturally reacting. It's not something that's like necessarily caused by you. So thank you so much for bringing that up. But kind of jumping into the primarily military prevalence that we've seen, Austin, I know you have quite a bit of experience and knowledge there, man. What can you tell us about the military prevalence of PTSD?
So yeah, for sure. I think when most people think of PTSD, one of the first things they think of is military, because it's very prevalent within the military, because they have to see a lot of horrifying things in war, right? So I have pulled up on my laptop the VA, which is the Veteran Affairs, and if you look, it gives you some statistics about PTSD through different wars. So if we look at the Iraqi War and the Persian Gulf War, the more recent wars, the rates of PTSD are from 20 to 30%. So that's a pretty decent amount of people, right? And if you look back to the World War II or Korean War, it says 3%, which is very, very low. And they went through the same process, same type of thing. You know, they both saw horrifying things. So it's very curious to wonder why are the rates so much higher in the recent wars. And I think the biggest thing that we can attest to that is the stigma. Slowly over the years, the stigma for PTSD has been broken. Back in the day, it used to be called shell shock, being weak, you know. It was horrible for any soldier to have symptoms of PTSD, whereas now it's more accepting because we know a little bit more about it, right? And I watched a very interesting documentary called War Torn, where it kind of brings you through this stigma and how it's been broken and how soldiers and veterans live with PTSD through their day-to-day lives. It's very interesting and gives you a very good perspective of what they go through. And I would really recommend it to anybody who wants to learn a little bit more about PTSD.
Awesome, Austin. Thank you so much for that, man. Kind of getting into the statistics of it as well. Again, we talk about it highly being primarily military, but getting a little bit more into the demographic statistics about it. JP, I know you're the man with the plan, the man with the numbers. Brother, what are they saying?
Yeah, so it's really interesting to see how the demographics fall out and kind of fill in throughout this, like how we understand the concept of PTSD and who it affects and stuff like that. About 5 out of every 100 adults, about 5% of the U.S. population deals with PTSD. And it's also important to understand, like Mike mentioned, that PTSD doesn't mean that PTSD and trauma is completely different. But in 2020, about 13 million Americans have PTSD. And it's just interesting to see how that number keeps growing as more people understand what PTSD is and what it entitles. Women are actually more likely to have PTSD than men, mostly due to the fact that they report it more often, and then they're also dealing with sexual assaults, other issues like that most men probably won't face. But it's also interesting to see how underreported PTSD is for men, due to the fact that it's only like 4% of men have had PTSD in their life. So that's half of the amount as women. And it's also interesting to see how men underreport PTSD due to social constructs and different social like stereotypes. So it's just interesting to see how it all falls into place when we talk about demographics.
No, definitely, man. And I really appreciate you breaking it down. And absolutely, I think that's something that we should definitely acknowledge, is that there is a little, well, not a little bias, there is a significant bias when it comes to PTSD and the diagnosis in women versus men. And I think one of the biggest underlying factors for that, like you mentioned, was the underreporting of men. Mm-hmm. Here we have 4 men, right? Like, it's not exactly super common that you're able to go and talk about, hey, look, I was assaulted. Hey, look, I went through this and it troubled me deeply emotionally. You know, it's not exactly something that 9 times out of 10 we're able to go up and like talk to somebody else again. You know, we're expected to be strong. We're expected to be like stoic pretty much. So it's very fascinating. Thank you so much for bringing your insight right there. Guys, we will be right back. We're going to take a super quick break. When we come back, we're going to have a few other classmates that are going to be giving their input on PTSD. Definitely stay tuned. We'll be back in just a sec. Guys, see you soon. We are back with the Mental Health Podcast. I am joined by a few more classmates today. We're going to go ahead, introduce ourselves one more time, and then we'll jump right back into the topic of PTSD. So we'll go ahead and get started over to my left.
Hello, I'm Rebecca with a concentration in OT.
My name is Valeria Vasquez, and I'm in the PT concentration.
My name is Joshua Solorzano, and I'm also a PT concentration.
Awesome, guys. And we are back to talk about PTSD. Now, earlier we were talking about military prevalence in PTSD and how it plays a big factor in essentially PTSD as a whole. One of the things we didn't cover so much was the impact that it has on people's families, you know, not just in the military, but overall the impact that it has on loved ones and people trying to be there to support them. Rebecca, I know you had some wonderful insight into the situation, so please enlighten us.
Yes, hello. So I have personal experience in this situation. My grandfather was in the Marines and my father was in the Army. So I grew up in an environment where I did have to just understand and be patient a lot of the time, because when you're dealing with someone who has PTSD, you just need to be really understanding in the fact that sometimes they don't have complete control over how they're reacting or how they take certain situations. So understanding the strain-on dynamics, such as the difficulty they might have maintaining a healthy family and just like dynamic and also overall relationships. Along with establishing new relationships, it's really difficult because those people aren't as familiar with their situation as we are. Communication and setting boundaries, that's also very difficult because usually they are older than you and you need to just really talk to them and be like, hey, that's not okay the way you're reacting with me, but I understand where you're coming from. Along with helping them realize that they're not 100% okay. And that just comes with the whole coming to terms with reality that they have been affected by some sort of trauma, which is not the same as PTSD, but they do have some effects with it, along with just mustering the courage to seek help. And that can go through family therapy or even medications, which I know Val is going to talk more on.
Yes. So there are two types of treatment, which are SSRIs, and this is selective serotonin reuptake inhibitors, and SNRIs, which are serotonin non-norepinephrine reuptake inhibitors. And to be more specific on the three types of medication that are mostly recommended for PTSD, these are, one of them is sertraline, which is an SSRI. Another is a paroxetine, which is also an SSRI. And then the last one is venlafaxine, which is an SNRI. And these are a list of the three medications that are most recommended for PTSD, but of course everyone's different, and medication does have to be, well discussed with your provider, and it's very important to go and make sure that the medicine that they're providing for you is right for that specific person. With that being said, many different type of providers, including your family provider and even some nurses and physician assistants, can prescribe antidepressant medication for PTSD. And like I said, you and your provider can work together to decide which antidepressant medication may be best for you. Also, I would like to touch on some of the risks that come with taking these medications, which can be mild to moderate, which can have mild to moderate side effects, such as an upset stomach, sweating, headaches, and dizziness. Some people do have sexual side effects, such as decreased desire to have sex or difficulty having an orgasm. Some side effects are short-term, though, and others may last as long as you are taking the medication. So there are other types of treatment with cognitive behavioral therapy, and it focuses on relationships among thoughts, feelings, and behaviors, and notes how changes in any one domain can improve function in the other domain. So yeah, it's proven that it can make a difference. And of course, there's other ones like we've touched base before, like Bailey had said on the intro of exposure therapy, and other ones.
No, that's absolutely wonderful. And one thing that we wanted to preface as well, this podcast is being recorded in the University of Texas at El Paso, Texas. So we do have a few local resources to list as well. We have mentioned cognitive behavioral therapy. We do think that that's one of the best things that you can do to begin to seek treatment that way. However, if that's not something that you're particularly interested in right now, or something that a loved one may not be interested in right now, there are also different support groups here in El Paso. Here we have listed the Rio Vista PTSD support group, the NAMI El Paso support groups, and then on the national level, we also have the Wounded Warrior Foundation that does provide resources and support for those veterans who are suffering from PTSD. But we just wanted to plug that in really quick because, again, guys, taking care of your mental health is very important. It should be a priority. It is a priority. If you're not able to function and be the best version of yourself, you can't bring out the best in others. So you always want to make sure you take care of yourself with that. But we're going to go ahead and jump into the research aspect of PTSD and kind of jumping back into the data. Josh, what's going on in the research aspect, man? What's happening there?
Yeah, thank you, Louis. So basically, my section, I wanted to discuss how, like, basically, this could happen to anyone, a colleague, a family member, a friend of yours. And as aspiring PT, OTs, SLPs, we want to pretty much do anything that we can. Actually, according to the World Health Organization, WHO, approximately 3.6 of the global population has experienced PTSD. And that roughly translates to 250 million people around the world who are affected by this condition, right? So I also would like to state that everything that we do in healthcare is because there's a patient demand for it. And we must be able to, as healthcare providers, meet these needs with high efficiency. Now, where does the research come into play? Research is important overall to PTSD and every other condition because it allows us to figure out what's the best step we can take. What's the next step towards treatment? What's the most efficient form of treatment? How is this usually done? Two of the most efficient methods of research are what is called a systematic review and a meta-analysis. A systematic review is basically you're pulling from all these high-quality papers. I would like to make connection to what my team member Val said. She was talking about how there's these different therapies, these different treatments, right? So all of those treatments basically evolution from it started as an idea, and over time with research, they were able to basically determine how efficient these treatments and therapies were. That's basically what you're doing with a systematic review. With a meta-analysis, you're pretty much doing the same thing, but you're taking a more statistical approach. With this, I would like to preface back to my to talking about treatments. And treatments, you see all these numerical values, how much, and basically with the meta-analysis, you're assessing that, how effective a treatment is and stuff like that. With this in mind, I would like to end my statement by saying that research contributes to the expansion of our understanding of conditions. It helps uncover the underlying causes, mechanisms, and risk factors associated with different conditions. This knowledge is essential for developing effective prevention and treatment strategies. Thank you.
Definitely, man. No, thank you. And again, if we're looking to be proactive about helping people who are suffering through PTSD, it definitely starts in that research aspect. We have to understand understand the problem to really be able to combat the problem. What do they say? You must know your enemy better than you must know your allies. Something like that. I don't know. I've never been in war, so if you couldn't tell. But with that being said, guys, we're going to go ahead. We're going to go through a totally not scripted conclusion right here. So in conclusion, as we wrap up today's podcast episode on PTSD, aka post-traumatic stress disorder, I really want to emphasize the significance of the information that we've covered. PTSD is a complex condition that can affect anyone who's experienced trauma, and by defining it, we've taken the first step towards understanding it. We've discussed its causes, common triggers, and delved into various symptoms individuals may experience, and explored the diagnostic and treatment process. Importantly, we've touched upon the stigma and misconceptions that still surround PTSD, and how it's crucial to reduce these barriers to begin the healing process for those affected by it. Support systems, self-care, and coping strategies are essential tools for those navigating life with PTSD, and we've highlighted their importance today as well. By advocating for awareness, prevention, and sharing stories of recovery, we aim to create a more empathetic and supportive community. Remember that through your engagement with these topics, you can help make a positive difference in the lives of those people who are suffering with PTSD. Again, totally not scripted off the dome. But thank you guys so much for joining us today for the Mental Health Podcast. I've been Louis, your host with the most. Thank you guys so much for joining me today. And Ms. Sanchez, this is recording number 3, so I would really appreciate 100. We had 3 times the workload, so I'll take 300. Matter of fact, some bonus. I think we should get some bonus on the final, guys.
Yes.
Yeah,
Yes.
bonus. Miss Sanchez, we appreciate you. But thank you guys. Have a great day.